There is a medical truth that many people are not clearly warned about a medication that feels familiar and safe. At age 40 can become a double-edged sword after the age of 70. This is not uncommon. It is a silent reality affecting many older adults. Many people continue using pain relievers, sleeping pills, or allergy medications for decades without realizing that their bodies have undergone profound changes over time. After the age of 70, vital organs, such as the liver and kidneys, begin to decline in function. Liver mass and blood flow can decrease by more than 50%, slowing down drug metabolism. At the same time, kidney function, which is responsible for eliminating drugs, also declines, causing medications to remain in the body longer and increasing the risk of side effects. Moreover, the central nervous system becomes more sensitive to medications. A dose that feels normal for a younger person may become too strong for an older adult, leading to drowsiness, imbalance, or confusion. Studies show that the risk of medication-related complications in people aged 60-70 is about twice as high as in younger individuals. In Vietnam, most older adults live with multiple chronic conditions such as hypertension, diabetes, and joint disorders. Taking multiple medications simultaneously increases the risk of drug interactions, making treatment much more complex. Therefore, understanding what you are putting into your body each day is key to protecting your health. To understand why medications change with age, we need to look at physiological changes. Think of the liver and kidneys as a city's filtration system. When we are young, this system works efficiently, but over time, its performance declines, slowing down the processing of waste, including medications. This leads to drug accumulation and increases the risk of toxicity. At the same time, the brain also changes. Neurotransmitters are altered, making the brain more sensitive to medications. As a result, drugs that affect the nervous system may have much stronger effects than before. Based on this, there are 5 common groups of medications that require special caution. 1. Sedatives and traditional sleeping pills. These medications are commonly used by older adults to manage insomnia or anxiety. However, in medical practice, they are often recommended to be avoided in the elderly. The reason is that these drugs remain in the body longer, causing drowsiness and reduced reflexes. The most dangerous consequence is an increased risk of fall. When the nervous system is suppressed, balance is impaired, and even a small misstep can lead to serious injuries, such as fractures or head trauma. Long-term use can also impair memory. Many people assume forgetfulness is part of aging, but it may actually be a side effect of these medications. It is important not to stop these drugs abruptly, as this may cause withdrawal symptoms. Instead, they should be tapered gradually under medical supervision. 2. First-generation allergy medications. These are commonly used to treat symptoms like runny nose, itching, or colds, and often cause drowsiness. However, for people over 70, they can significantly affect brain function. The main issue is their anticholinergic effect, which interferes with acetylcholine, a neurotransmitter essential for memory. As a result, users may experience memory loss, confusion, and difficulty concentrating. Other side effects include dry mouth, blurred vision, and urinary difficulties. More concerning long-term use has been linked to an increased risk of dementia. Fortunately, newer generation allergy medications are safer and do not have these harmful effects. Always consult a pharmacist or doctor when choosing medication. 3. Non-steroidal anti-inflammatory drugs. These are widely used for joint pain and inflammation. However, in older adults, they can cause serious complications. First, they affect the kidneys by reducing prostaglandins, which help maintain blood flow to the kidneys. This can lead to kidney damage. Second, They can harm the digestive system, increasing the risk of stomach ulcers and gastrointestinal bleeding. Third, they can worsen cardiovascular conditions by causing fluid retention and increasing blood pressure. Safer alternatives include mild pain relievers like paracetamol and non-drug approaches such as physical therapy and exercise. 4. New generation sleeping pills. Although often marketed as safer, these medications still carry risks for older adults. The main issue is the residual effect the next morning. Even if you feel awake, the drug may still be in your system, impairing coordination and alertness. This significantly increases the risk of fall. Therefore, sleeping pills should be a last resort. Lifestyle adjustments such as maintaining a consistent sleep schedule, reducing screen time, and creating a comfortable sleep environment should be prioritized. 5. Stomach acid suppressants. These medications are commonly used long-term to reduce stomach acid. However, prolonged use can lead to deficiencies in essential nutrients such as vitamin B12, calcium, magnesium, and iron. Vitamin B12 deficiency can cause fatigue, numbness, and memory problems. Calcium deficiency increases the risk of osteoporosis, while magnesium deficiency can lead to heart rhythm disturbances. Thus, these medications should not be used long-term without medical supervision. Regular blood tests are necessary if prolonged use is required. A major concern: polypharmacy. One of the biggest risks in older adults is taking too many medications at once. As the number of drugs increases, so does the risk of interactions and side effects. Medications can interfere with each other, reducing effectiveness or increasing toxicity. This places a heavy burden on the liver and kidneys. More medication does not mean better health. The key is using the right medication appropriately. Safe practices. Make a medication list. Include all prescription drugs, over-the-counter medications, and supplements. Consult your doctor regularly. Ask whether any medications can be reduced or discontinued. Prioritize non-drug solutions. Exercise, lifestyle changes, and physical therapy can often help. Schedule regular checkups. Monitor liver, kidney function, and nutrient levels every 3-6 months. Conclusion: after the age of 70, health is not measured by how many pills you take, but by your mental clarity and physical independence. Reducing unnecessary medications can sometimes be the best way to improve health. Always remember the principle: right medication, right dose, right timing, and careful monitoring. A healthy lifestyle, combined with a proper understanding of medications, is the strongest shield for long-term well-being.